Hi, my name is Razan Israel. I'm a registered speech-language pathologist and owner of Fun2Talk and Associates. Many of the new referrals that I receive often have questions about apraxia, or better known as childhood apraxia of speech. In this video, I'd like to explain a little bit about apraxia and how it fits into the broader spectrum of motor speech disorders.
Motor speech disorders are sound production difficulties that are caused by an underlying deficit in motor or movement control. There are three motor speech disorders in children, and they are dysarthria, developmental apraxia of speech, also known as DAS, or a combination of both. Motor speech disorders are not the only cause for difficulty producing clear speech. There are other disorders such as articulation problems, phonological delay, hearing difficulties, or structural abnormality such as a cleft palate. But for the purpose of this video, I will be focusing exclusively on motor speech disorders. The first motor speech disorder I will discuss is dysarthria.
Children may have difficulty executing the movements needed for speech when the muscles of the face, mouth, or breathing become weak, don't move properly, or move too slowly, and this can affect the clarity of the speech.
Dysarthria is a motor speech disorder caused by damage to the brain or nerves that results in changes in muscle tone. Muscle tone can either be low tone, where the muscles are looser and floppier than usual, or it may be high tone, where the muscles are tighter and more rigid than they should be. The symptoms of dysarthria include slurred speech, speaking too softly, a reduced rate of speech or sometimes a very rapid rate of speech, drooling, limited control of jaw, lips and tongue, as well as breathiness and sometimes hoarseness, and nasal sounding speech. Many children with severe speech sound substitutions do exhibit signs and symptoms of dysarthria, such as drooling or slurred speech, but there may not be a known medical cause for it. Even though there is no brain or nerve damage, many speech-language pathologists do still use the term dysarthria because it describes the symptoms so well. But other speech-language pathologists will shy away from this term, preferring only to use it when there is a neurological diagnosis.
If the speech-language pathologist is not using the term dysarthria to describe dysarthric-like symptoms after evaluating a child with motor speech difficulties, then he or she may rather choose to describe the specific deficits. He or she may use terms such as difficulty executing motor speech movements, or difficulty with control of lips, or difficulty with saliva management.
A second motor speech disorder is called developmental apraxia of speech, or DAS, also known as childhood apraxia of speech, or CAS.
In developmental apraxia of speech, the child has a hard time coordinating and planning the precise and intricate movements of the voice box, the breathing, the lips, the tongue, the jaw, and the palate in order to produce intelligible speech. Developmental apraxia of speech is a very mysterious disorder for parents to understand. In the adult population, acquired apraxia of speech occurs when there's some kind of damage to the brain, such as a stroke or a car accident. And medical science has been able to pinpoint the exact location of the damage in the brain that causes apraxic-like symptoms. The same is not the case for children. There are many theories as to what causes apraxia, but there's no definitive answer, and this can be most confusing for parents. Another source of confusion for parents is differentiating between apraxia or developmental apraxia of speech and dysarthria. I always explain to the parents in terms of thinking of the process of being able to produce words. When somebody wants to speak, they first have to think of their ideas, think of the words that go with those ideas, and then the brain needs to send a message to the muscles as to how to move in order to produce those sounds. Finally, the muscles need to actually execute those movements.
If there is a breakdown at level 3, the planning stage of movement, that would be developmental apraxia of speech. But if the breakdown occurs at level 4, where the muscles are actually needed to execute the movement, that would be dysarthria.